In 2018, I had the opportunity to volunteer with Budabika East London Link in Kampala, Uganda, and I worked at the children's ward there in the hospital, seeing patients for most of a year. And in that time, I was seeing families with children with all sorts of presenting difficulties, most commonly epilepsy, but also intellectual disability and autism, functional neurological disorder, anxiety disorder, all sorts of challenges that they would come for consultation with. But in particular, having a long-standing interest in tics, I was very interested to see what their needs were around tics. And surprisingly, I saw very few patients come for difficulties related to tics. We did have several cases, but in terms of seeing several hundred children over the course of that year, it was quite a low number of children with tics. A couple of cases that were seen had quite marked and severe tics. Some of them had some of the copper phenomenon that we were talking about earlier, which I think was probably a main motivator to come. Some other children had also been misdiagnosed, and I know this happens all across the world, particularly if they're seen by a non-specialist. And so that was a very enriching and hopefully helpful to the family contribution when we were able to offer helpful psychoeducation on what the tics actually were and indicate what treatment might be useful. I was able to do some research while I was in Uganda with some of my professional colleagues as well.